So I didn't actually have any symptoms when I went and first saw my cardiologist. I went purely because my father died of coronary artery disease a few years ago now, and I knew that my family history, I also had my grandparents pass away from coronary artery disease as well. So I kind of become a little bit proactive with my health and decided to see a cardiologist. So I had a coronary calcium score test, and that showed that I had plaque in my left anterior descending artery of my heart. He didn't do any other tests for quite some time after that, and it wasn't until recently that he decided to do a lipoprotein A test, and that come back as elevated. So that changed everything, really. Changed the way he was looking at managing my disease. I knew a little bit about coronary artery disease anyway. It's because I'm a nurse. So it makes a bit of a difference. So I was very proactive in researching and all that sort of thing. So I do my own literature reviews and things from back in nursing school. So I kind of was on top of it. He's diagnosed me with early stage coronary artery disease. And he told me that for my age, because I was diagnosed at 43 years old, that I was in like the 95th to 97th percentile. And he told me that if I wasn't started on medication, that it wasn't a good outlook. So basically, in the next 10 years, he said my chance of having a heart attack was quite high. Only treatment option that was discussed was starting on a high dose statin, and I was commenced on 20 milligrams of rosuvastatin, which is just straight up really high dose. Yeah, and there were no actual other treatments mentioned. It was just basically start the statin. We need to get onto this, and I basically then become proactive, looking at other ways as well that I could help myself. So, with regards to stress management, eating well, exercising, and all that sort of thing, just to try and decrease my risk for future events. And personal goals is to basically follow what the cardiologist is saying. So, he's saying to drop my LDL down to below 1 now, which is quite extreme. So I'm really focusing on that. And my big goals are just to live a happy, healthy life, really. I love hiking, so I just want to go out in the bush and just seek nature. And basically, I just want to live in the moment as well. I think it's looking at my blood tests is the important thing for me. Just checking my cholesterol levels and making sure that they're at target or trying to get down to target. So that would be an indicator of that the medication's working. A lot of information about lipoprotein A and familial hypercholesterolemia and all that sort of thing. And plus, at work, I look up journals, so I'm up to date with my research. I've honestly haven't had too much information from them. I've pretty much looked up my own information. They've told me what it is, but they've never gone into great depth, which is a little bit discouraging. But I think the fact that I've been able to look up my own information has made me more powerful, as in I can actually advocate for myself a lot better, and I kind of know what I'm talking about. So it's been a bit like sometimes I have to talk when I talk to the GP. They, like for instance, the GP didn't really understand what lipoprotein A was, so I had to describe it to the GP. So I think it's not I know it's not as tested as much as what it should be. So probably that's why. Just trying to decrease my my risk for future cardiac episodes. So ensuring that I get, a good optimum amount of sleep every day, every night, between 6 and 8 hours, trying to decrease my stress, looking at my nutrition. And also because lipoprotein A can be highly inflammatory. So looking at things like, adding more turmeric to my diet and garlic, increasing my fruit and veg in my salmon and things like that. I think if I had have known about lipoprotein A earlier, I think I would have asked to have been tested earlier. I didn't ask to be tested this time, but I do remember a couple of years ago seeing the cardiologist, and I told him, I said, can I please be tested for lipoprotein A? And he said, no, there's no need to test for that. But I didn't kind of go into it with him. And then it was 2 years later that he decided to perform the lipoprotein A test. So I'm not sure what changed his mind there. Maybe it was his own research and he was looking into it himself. But I think maybe if I had known back then, I could have been much more of an advocate for myself. More testing for lipoprotein A is a big one. Research shows that statistically that 1 in 5 people could be walking around with elevated levels of lipoprotein A, and I don't think there's enough testing for it. And if people knew that they had this elevated lipoprotein A, that would give them the chance to become more proactive with their health. So maybe exercise more if they smoke to try and quit. Good nutrition to try and eliminate all sorts of stress. Maybe, get onto some medication to try and lower your LDL. I think that's really important. At the moment, I don't think there's enough knowledge about it as well in Australia, about lipoprotein A and its effects. So I think that would be a big message.